So in terms of orthostatic or postural hypotension, this is where you get an abnormal drop in blood pressure when moving from a lying to a standing position. In other words, you get a drop in systolic pressure of 20 millimeters of mercury or diastolic drop of 10 millimeters of mercury within 3 minutes of standing. Now, we've all at some point felt lightheaded and dizzy, and some of us might have actually fainted at some point when immediately standing from a lying position. But this should disappear within a few seconds. Why does it usually disappear? What is happening in your body? I want you to think about it. You've often been lying down, you jump up really quickly and you feel really, really lightheaded, and you might just bend down a bit or hold onto a chair or something to stop yourself falling. But actually, why within just a few seconds are you able to stand up quite normally again? What's happening? So what's happening when you've gone from this lying to standing position is you're getting pooling of blood in the lower part of the body. So this leads, because the blood is now in the lower part of your body, leads to cerebral hypoperfusion. So symptoms therefore include lightheadedness, dizziness and fainting. But what happens to overcome this? Well, your sympathetic nervous system becomes activated. It's your baroreceptor reflexes. So your heart rate and stroke volume rapidly increase. You get vasoconstriction very rapidly, and therefore you're getting an increase in your cardiac output within a few heartbeats. So it's just within 4 or 5 heartbeats, your blood pressure up to your brain should be back to normal, and therefore you should be able to stand nicely without feeling all lightheaded. So what happens is you're lying down, you come to a standing position. You get that pooling of blood in the lower part of the body. It's around about 600 mils, so it's a significant amount. That leads to a decrease in your central blood volume and blood pressure. That activates your baroreceptor reflex, as we've just talked about, leading to your reflex vasoconstriction in your arterioles and veins. Leads to increasing your blood pressure back to normal. Leads to an increase in your heart rate and stroke volume. Increasing cardiac output, bringing your blood pressure back to normal. You've moved into this standing position. This is obviously using leg muscles. Those leg muscle contractions lead to compression of your veins. That leads to an increase in your venous return, which through Starling's forces increases your cardiac output because you get increased cardiac filling. And therefore, your Starling's law, increased stretch, increased recoil, increased stroke volume and cardiac output. So really when we're thinking about orthostatic hypotension is any condition that reduces blood pressure or impairs mobility, results in prolonged inactivity and impairs also your autonomic nervous system function. So there are lots of things that can lead to this. So aging, for example, your diminished ability to produce adequate increase in your heart rate, your stroke volume, or your total peripheral resistance. You have decreased skeletal muscle, so therefore for a decrease in your venous return, a decrease in your blood volume. The reduced blood volume may be because of diuretics or loss of gastrofluids, so vomit and diarrhea, for example. And bed rest and impaired mobility, this may cause a reduction in plasma volume very rapidly within 3 days. Decrease in venous tone, so loss of muscle within a couple of weeks. And that muscle weakness as well within a couple of weeks. So you've got the smooth muscle in your venous tone and your skeletal muscle in terms of your return, your skeletal muscle in stimulating venous return. What about some of the disorders of the autonomic nervous system? So there are peripheral neuropathies such as diabetes mellitus. There are a variety of injuries, spinal cord diseases, Parkinson's leading to autonomic nervous system failure. There are all kinds of potential disorders of the autonomic nervous system. Diagnosis is your blood pressure is measured lying down and then 1 and 3 minutes after standing, whereas in a normal individual, your blood pressure should have returned to normal. In those with orthostatic hypotension, it won't have done. Treatment, you need to treat the cause, whatever that might be. You may use a different antihypertensive if it's the antihypertensive that is causing the hypotension, and you may need to give mineralocorticoids as well. So last little question. Press pause before you answer it, have a little look, see what you know. Which of the following are true regarding orthostatic hypotension? It's due to a drop in both systolic and diastolic pressures. That's false. It can be due to just a drop in one or the other, as well as both. Number 2, on standing, in health, blood pressure drops are immediately compensated by the baroreceptor reflex and later on by ADH and renin release. That is true. So the short term is your baroreceptor reflex, later on is by your blood volume system, so the renin, angiotensin, aldosterone system. Activation of skeletal muscle pumps on standing increases venous return, which causes a decrease in stroke volume and an increase in heart rate. That is increase. That is false. You get an increase in your stroke volume, very little effect on heart rate. Number 4, a decrease in blood volume will make individuals more susceptible to postural hypotension. That is correct, as you might expect.